Hey friends, Kambria Evans here with the Zero Disturbance podcast. And y'all, in this series, Dumb Things Therapists Say, we are talking about all of the lifelong learning that we get to do in the therapy room. This series has been such a blast to put together. It's based on dumb things I used to say as a therapist before I learned something different. It's based on dumb things my consultees have said in consultation with me for EMDR. And it's just a reminder that we are programmed and told different things, and it is part of our job and joy, really, to keep learning new ideas and keep using our discernment and keep challenging the status quo of what we've been told in service for the efficiency and effectiveness of what happens in the therapy room. So, what are we talking about today? We're just talking about the tiny little topic of how to change behavior. That's all. It's a mouthful, right? It's like, we're going to take all of it in and we're going to digest this together. And the reason I want to talk about this is because there is a dumb thing therapists say about changing behavior, especially when we're talking about changing behavior that we consider to be addictive or compulsive, meaning the urge is so great that despite the consequences, the behavior continues towards this positive feeling state. I think the average relapse rate for people who are working through compulsive behaviors that they consider to be addictive is something like 8 times is the average before people are considered sober. So, if you're working in a rehab clinic, if you're working in any kind of addiction, whether it's with food or alcohol or drugs or shopping or gambling or sex, whatever someone has decided is out of control, that the urge is so strong and they don't feel like they have a sense of control with the behavior, this episode's for you to notice in yourself, what dumb things am I saying about this? Right? If you are a client who identifies as having compulsive behavior, maybe you call it addiction, this is for you. If you are somebody who wants to create a habit, which is forming a new behavior, you are not going to want to miss this. You're not going to want to miss this. I want you to notice the dumb things therapists say around this idea and the dumb things coaches say around habit formation and changing behavior. Because what all the EMDR clinicians already know and the brain spotting clinicians already know is that basically we can make a habit, we can change a behavior. And unfortunately, that is the end of the code. That is the end of the programming. That is one of many variables that are going to make it successful or not, right? Same when we have people in eating disorder clinics or addiction clinics or alcohol clinics, any kind of rehab, same thing. There's so much focus on behavior and beliefs. And while that is part of the code of how our bodies are programmed, it is incomplete. And stopping there not only is lazy, it's just a waste of everyone's time. I mean, could y'all imagine if they offered EMDR in all rehab clinics? Would it be an 8-time average relapse? I don't think so. Okay, so hopefully by now I've gotten your attention. And I'm glad I have it because this is really, really important. The last couple years, I've had a lot of CEOs and SVPs and VPs and people with, titles with lots of letters find me because they are looped in and they understand how powerful EMDR can be. They understand that we have the framework for the programming and understand all of the variables that allow them to de-link and reprogram things about their experiences that are negative, right? Negative beliefs of self, negative body sensations. We can desensitize this with EMDR. They understand, just like all EMDR clinicians, that we are programmed, right? And that a lot of the labels we walk around with, like, I have anxiety or I have depression or I'm an addict, like these are all just programming, right? And I think what makes me really sad is that when there's a talk therapist or a coach or a rehab clinic that does not offer a brain-based modality like art, brain spotting, EMDR. There's going to be a lot more created, I'm sure. You can't de-link behaviors from positive feeling states. You can't change people's urges. You can't change their programming, which has multiple variables of code in it, right? Body sensations, beliefs, memories and images, emotions, by only focusing on beliefs and behaviors. And you know what else isn't going to work? Shame and blame. Let me give you an example. And I'm not bashing AA, but I don't like this. And I'm going to read this to you. So I just looked on this in the internet. What does AA say about relapse? Okay. It says in the big books of Alcoholics Anonymous, those who do not recover are people who cannot or will not completely give themselves to this simple program, usually men and women who are constitutionally incapable of being honest with themselves. And that is where relapse comes in. What? That is so messed up. That is so gross. And here's why. Basically, if we only focus on behaviors and beliefs, if we only say you should be sober because that means that you're good, or whatever we're saying to ourselves about how we change the behavior, right? Do not put yourself in a position of authority talking to people like this if you do not understand this person has been programmed. We all have been programmed, okay? It is not a matter of willpower. That's part of it. It's not about being capable or incapable or honest or dishonest. That's part of it, right? But what we're asking anybody to do when they have a compulsive behavior that is heavily, strongly attached to a positive feeling state, yeah, there's lots of consequences. They know what the consequences are. They feel terrible about it, right? But when we have this compulsive behavior linked strongly to a positive feeling state or the promise of a positive feeling state, guess what? Shame isn't going to de-link that. Telling somebody that, you're not honest enough or you're not capable enough, that's not going to de-link it. Actually, what it's going to do is probably make them go drink more and feel shitty about themselves, okay? So here's what dumb therapists say, and here's what dumb coaches say. Stuff like this, right? Because what we know as brain-based therapists is that good luck de-linking that without some kind of bilateral stimulation, EMDR, brain spotting. Good luck trying to reprogram that looking only at behavior and beliefs, because you are completely leaving out emotions, body sensations, and guess what? All of the early childhood programming that program that compulsive behavior with that positive feeling state. You want someone to just put all of that somewhere and then just go ahead and get sober? This is why people relapse, because this entire framework makes no sense at all. Here's what makes sense to me. Because we have 3 addiction protocols in EMDR, 3 of them, and they're gorgeous. Because what all of them have in common is that they understand that the compulsive behavior and the positive feeling state are so deeply linked and have generalized for so long, right? That needs to be the area of focus and attention. And guess what? Typically, when people are programmed that way, they're like under 18 years old. A lot of people who have compulsive behavior on drinking, they start drinking at 9, 10 years old, right? So good luck telling the 35-year-old in the AA meeting, well, you should just do this and this and this. And if you can't do it, you should call this person. Now, am I saying AA is bad? No. I love that there are supportive groups for people that are working through hard things. I cherish that. But here's what I wish. I wish there was a more comprehensive conversation in addiction groups, in clinics, in rehab clinics, for people to understand that shaming them about how they were programmed, not who they are. I'm not an addict. I was programmed to have an addictive compulsive behavior, okay? And using a modality, which is not talk therapy, by the way, to reprogram and de-link all those things. Because here's what happens. Let's say somebody gets sober, okay? And they don't drink anymore. But guess what? That positive feeling state, that urge is still there. That programming, all of that early childhood stuff, still there. Didn't do anything to that, just focusing on the behavior and the belief, right? I'm sober now, that means I'm good. Okay. Guess what? Have y'all been to an AA meeting before and seen people outside just like chain smoking cigarettes or like eating compulsively? The energy, the urge is still there to get some kind of positive feeling state. Oftentimes it's just comfort and soothing, right? Because for a lot of us, compulsive behavior, no matter what the substance is, whatever the thing is typically about numbing out, getting comfort, feeling our bodies, feeling good enough, whatever it is. Like there's all these beliefs and stories attached to this. If we don't work with that early programming, good luck. Good luck staying sober. And the same holds true with habit formation, right? So we have these really smart people that I get to work with. They come in and they say, Kambria, I've been reading about EMDR. I want you to help me desensitize this list of limiting beliefs, these body sensations, this tight chest, this paranoia I have about my company, whatever it is, right? And then after we desensitize that, I want us to go ahead and do performance enhancement. And I want to develop all these new parts of myself and expand them because I understand that brain-based therapies like EMDR can actually reprogram not my beliefs, but my body and my urges and what my nervous system has decided is linked. What behaviors or habits are linked to what positive feeling states, right? Because just like with addiction, right? Unless maybe you de-link the drinking and then you relink with smoking. Maybe you de-link the drinking, but you relink with food, right? When we do EMDR or any brain-based therapy, we are consciously deciding, okay, we've de-linked this behavior. What are we going to link this positive feeling state to? Because you still need that. You still need to feel comforted and soothed. Do you want to consciously decide to link it to food? Usually not, okay? But if you don't consciously relink with programming in your neural networks in your body, good luck. Good luck, guys. It's going to be really hard. And you're going to use so much of your energy, like trying, convincing yourself, I'm going to stay sober. I'm not going to pick up that drink. I'm going to cut it out. This is all a waste of energy because we're not using a brain-based therapy to just make it more neutral and go to the place where the programming was created and then reprogram it, right? So habit formation. I had a woman in here and she runs a company and she said to me, well, I've been researching this and it sounds like it takes 34 days to make a new habit. So I want you to help me make all these new habits so I can run my company successfully. I said, okay. I said, I'm not going to guarantee anybody that it takes 34 days to make a new habit because what I understand as an EMDR therapist is that we can create a new neural pathway. We can expand a new resource. We can take a behavior and link it to a positive feeling state, right? But here's what's true. We don't know yet what is programmed that's going to be in conflict with that, right? What old learning or old curriculum or old programming is going to bump up against that habit. Let's say you are like, my new habit is I'm going to go for a walk every morning for 30 minutes and I'm going to watch the sun come up. I'm going to get fresh air and I'm going to get natural light. By the way, this is a beautiful habit to start to create. I love this. And then the goal is mental health improvement and also I'm going to have a better physical health, right? Because I sit at my desk all the time and it doesn't feel good. Okay, gorgeous. So let's say you start to do this new habit. And here we are, we're walking every day, we're feeling great. And then what happens? We have some old curriculum, some old programming. At the end of the day, come home from work, what do I want to do? I want to eat a box of Girl Scout cookies, or I want to have a bottle of wine. I want to do something that's already programmed that kind of makes my habit not as effective, right? So we can create new habits. And yes, the neurons that fire together wire together, meaning the more we do something, we can call it a habit or a new behavior, the more we do that, the stronger that neural pathway is going to be. Beautiful. I love that. I love that our nervous system does that for us. I think that's incredible, right? But the problem is, unless we understand what other programming is there and have a modality to delink and reprogram it, a lot of our habits become less satisfying to us. They don't feel as good. Imagine knowing I'm going to go for this walk every day. I'm going to work on my physical health. I'm going to go back to the weight that is, recommended for me to be considered not obese. And I'm going to do this. Imagine trying to do that and you're doing the habit and you're doing the habit and it actually starts to feel good. Habit formation sticks when the neural pathway becomes deeper and the behavior is now linked up with a positive feeling state. Man, I feel good when I'm outside walking in the morning. Oh God, now my brain associates it with like music that I love and like the neighborhood's so quiet. It's just, I'm like out there like with the sun rising. It's amazing, right? You have intentionally programmed yourself to have a behavior with a positive feeling state. So many positive associations in there, right? So cool. I did this to myself with rowing a couple of years ago. Y'all, I did not want to get up at 5:45 in the morning, drive down the street, and start a 6:15 rowing class. But I programmed myself to create this habit, not just because I knew the behavior would stick, but like the urge. I actually now like have an urge to go rowing because I know it makes me feel so good and alive and powerful. And they're going to probably play some really cool music, which totally gets me like super excited to be alive, right? I'm there like rowing and singing the jams from like college. So all of that's amazing. And we want to make sure that when it comes to delinking habits or behaviors, we have a modality to help us do that. Okay. And we're not going to use shame and blame because that's not even part of like what we do in EMDR. There's no part of those 3 addiction protocols that delinks compulsive behavior that says, tell someone they are an addict. They don't need that label. That doesn't matter. And then make them feel like shit about themselves. Make them feel bad about themselves because shame's a motivator for changing behavior. We don't do that in the EMDR community because we know better. Okay. So we've talked about how behaviors and beliefs are the end of the code, how that's an incomplete treatment plan, and is actually the reason why people relapse. Dumb things therapists say, when therapists say, well, you relapsed because you're an addict. No, actually, I want to challenge that. And I want to say, your treatment plan is incomplete and it's lazy because we have other things you can do to actually help someone have a different emotional experience of themselves, to actually change their associations and urges instead of fighting the urge that you never changed because you didn't do a brain-based modality. I said what I said. I'm going to get some emails about that, but that's okay. So we talked about what a complete code means in brain-based therapy, right? Like images, negative and positive beliefs, emotions, body sensations. And then from that, an urge is created. We get really curious in EMDR and also like somatic experiencing. We are curious about like, is there an urge? When you notice this thing, is there an urge towards something? Is there an urge to pull back, right? We're curious what the body has been programmed to do around that, okay? And then we're curious about, well, what's the adaptation from this experience? What did you learn or decide about yourself? But then what did you start to do? What is the behavior? An adaptation is a behavior. That's all it is, right? Eating, drinking, fawning, fighting, dissociating, shutting down, isolating. These are all behaviors you learn based on oftentimes early programming, okay? So ignoring all of that in rehab centers or AA, telling someone something's wrong with them, but then not having the complete ability in the modality to actually treat it, this is just messed up. And I'm speaking this way because I want people to understand what I understand so that it can be different, because it can be different. It can be easily, okay? I get really curious as a therapist about the adaptation that people choose. They can call it a behavior. And then once I understand the adaptation, I get curious with them and say, okay, if we were to work backwards, if we were to reverse engineer this, why do you think you started drinking? I don't know. It just kind of helped me like numb out my parents fighting. Okay. What's the most disturbing part of that now? When you think about that, I can pull up that picture in my head of being 11 and just opening up my dad's liquor cabinet and just thinking, maybe this will help me. Beautiful. Good noticing. Help you do what? I don't really know. Help me just like not get so upset, not have to be so present with all of their chaos. Okay, now we have the beginning of the code, the beginning of the programming. And guess what? 11 years old, not really the beginning, but it's a place to start. It's a place to start. We're probably going to go back earlier than that. Or we might even go back to like pre-verbal stuff. Doesn't matter. But we have a starting point. And nowhere in this target setup have I said, you know what? You should feel really bad about yourself because you can't stop drinking. I never have a part of me that's like, hey, you know what? Your wife left you and your kids hate you. You want to stop drinking yet? None of that. This person already knows all of that, right? And the desperation and the helplessness and the shame, we're not going to pile that on, right? We're going to join them in their programming and say, hey, guess what? This can feel different for you. We can actually desensitize the urge to do this. And then we can take the positive feeling state of you wanting peace or safety or whatever it is you were looking for at 11 years old or probably earlier. Let's figure out what we want to link that to now. You can decide that now because you are powerful and you have choices. Okay? If you are somebody who struggles with compulsive behavior, if you are somebody who wants to create a new habit, I think that what you're about to embark on is really exciting. We do have a client workbook here at Zero Disturbance that I'm really proud of. It's a culmination of all the things I've been doing with my clients the last decade. It's EMDR informed treatment planning, it's trauma informed, and it's just a bunch of conversations like this. I have 15 unique assessments. I have 3 hours of videos where I walk through the 70-page workbook. And you can use this if you are with someone in therapy. You can use this if you're going into rehab. You can use this to have some kind of agency to understand yourself without shame, without judgment. So if that's interesting to you, you can check out the link below. I want you all to know too that my filter is becoming less and less as I do this job more and more, because I'm well aware of the fact that there are millions of people who need support. I believe most therapists and counselors and coaches are like beautiful souls. And I'm well aware of the fact that I have been told things in my trainings and by mentors and supervisors that I now realize are lazy, are incomplete, and that we can do better to serve people faster and more effectively. We just can. We already know how to do these things. So I'm on a mission to be very clear, and especially on this topic. I come from a family on both sides with lots of addiction, lots of compulsive behavior. I see and understand the consequences of that. And I take this topic very seriously. So please know that all the things I've said in this episode are personal to me and they're important to me. And I feel protective of families. I feel protective of kids. I feel protective of everyone trying to figure this out. So whatever has been helpful from today's episode, please take it with you. And I do enjoy a thoughtful conversation, and sometimes I get passionate because these things are important. All of you are important. And until next time, y'all, please take care of yourselves, and I look forward to hanging out with you then. Be well.